Hello, my response is into Mary Rachel's video in regards to type 2 diabetes. When I worked on the med-surg floor at Good Samaritan Hospital, we would constantly get patients in who had uncontrolled diabetes type 2. A lot of the times it was patients that were unfamiliar, whose lifestyle habits were eating out all the time, not proper exercise, and we saw way too many cases of patients who had injured a toe or their foot, and it got to the point where they just let it go until they had to come in and got amputated. I've seen a lot of patients with really bad ulcers and wounds on their feet because of the proper lack of care for type 2 diabetes. Sometimes the patients don't quite understand what exactly they need to do, or don't control it because they think that if they don't pay attention to it, it goes away, or it's not going to really bother them until it gets to that point. So a lot of times there is a lot of education, and like Mary Rachel said, in getting diet. We had dietitians come in and talk to them, and just education on what exactly diabetes was and how it was working in your body, and medications, giving themselves insulin. We would teach them how to do insulin injections and then let them do them so that they get more comfortable with them while they were in the hospital, so that when they went home, it wasn't something that was really they were unfamiliar with. But we get repeat patients because they either didn't have the insurance to pay for the medications, they didn't have insurance to pay for the test strips to constantly keep an eye on their blood sugar, and a lot of times some patients want to eat what they want to eat and they won't obey the proper diet. So it's just a reoccurring nightmare until they have amputations, or I've seen wounds just horrendous because of uncontrolled type 2 diabetes. When I was in nursing school, I did clinicals at a hospital where this woman had an abdominal abscess, and she had it drained. However, she didn't take care of it, and she was a type 2 diabetic, and she refused to eat properly because she didn't have the money to buy, she said, real food. So she would eat ice cream and popsicles all the time. So when she came in, I remember her blood sugar was over 873. Her abdominal wound had dehisced, and it was just non-healing, very bad smell. That's one of the worst aspects of the type 2 diabetes, when it's uncontrolled. If you have wounds, your body cannot properly heal. So a lot of times, like Mary Rachel was saying, literacy versus patients who just don't quite understand. If they're open to teaching and learning, you can teach them, but it's easy to control it while you're in the hospital, or you have somebody who really wants to make a change. But sometimes older people, and especially in hard times, they don't want to or can't afford to buy the products that they need, whether it be food or medication. So it is a growing epidemic, with more and more people eating more and more fast food, more fatty foods, more overweight, not wanting to exercise, and it's rampant. So there's a lot to be said for just trying to educate the patient. Thank you.